everyone. Welcome to our channel. Today, a patient named Dianessa came to see us. Welcome, as they say. She works as a dancer and is constantly wearing high heels, which causes discomfort in her lower back. Naturally, this issue is more noticeable towards the evening after long periods of standing and walking. We discussed her condition briefly, and now we'll proceed with the examination. We'll start with the axial load assessment, meaning she will stand while we observe the alignment. I would like to take a moment to kindly ask our viewers to subscribe to our channel, leave a comment, and support us. You can also find all our other platforms linked below the video. We also have a website where you can learn about our treatment methods for herniated discs. Before and after studies, results, everything is there. You can sign up, call us, and start your treatment. It's never too late. Now, back to the examination. I ask her to stand up straight so I can observe her posture. As I palpate the muscles, I can hear a bit of clicking. There's some muscle tension. I ask if it's painful, and she confirms. I continue the assessment, and I notice some asymmetry around the pelvis. When I place my hands on her iliac crests, I feel that the right side is slightly higher than the left. The camera might not fully capture it, but it's evident upon palpation. Next, I ask her to turn around and bring her shoulders inward. I take note of her posture and the alignment of her spine. We decide to move over to the therapy table, where I can get a better look at her muscles in a relaxed state. After that, we'll proceed with some manual therapy, stretching on the bar, and see what kind of results we can achieve. We begin with measuring her height. She says it used to be 167 centimeters, but we measure it again just to be sure. A bit of back and forth with the height measurement, but we finally confirm it. Now it's time to move to the therapy table. I ask her to lie down, and I begin the assessment. When lying down, the muscles relax, which allows me to feel more accurately. There's clear tension, especially on the left side. It's as if the muscles are shortened, which is evident from the way her shoulders rotate inward. I continue the assessment, and she confirms there's pain, although not as strong as in other areas. On the right side, the shortening is even more pronounced. I explain that we'll start with a massage, and then move on to manual therapy. After that, we have an interesting exercise to perform, so I encourage viewers to stay tuned. We begin the massage working through the muscle tension using a cupping method, vacuum massage, as it's called. We have a separate video on that technique, which I'll link in the description. Cupping leaves some bruises, but that's a good indicator of where the muscle tension is located. For Dianessa, it's pretty much the whole back. I ask if she's relaxed, and she confirms. We proceed. I ask her to relax and release the pelvis. Sometimes, this part is challenging for patients, but she does well. I move to her shoulder and gently ask her to let go. I joke that she doesn't need her shoulder right now. I work through the tension, and it loosens up nicely. Next, we move on to lumbar rotation. I explain the movement and ask her to rotate her lower back. There's some resistance, but I guide her through it. We switch sides and continue the rotation. I can hear some slight adjustments in the joints, which is a good sign. we proceed to decompression. I explain the importance of proper decompression and how it helps release pressure in the lower back. She seems familiar with the term and confirms she came specifically for that. I guide her through the stretch, carefully ensuring everything is aligned. After the decompression, we move on to stretching the legs. I help her with each leg, guiding her through the proper form. There's some resistance, but it's manageable. I remind her of the importance of stretching and flexibility, especially considering her work as a dancer. Finally, we move to the hanging bar for a full spinal stretch. I show her how to properly hang and allow her spine to decompress fully. At first, she's a bit hesitant, but she manages. I joke about her holding on tightly, and she laughs, saying she feels the stretch in her lower back. We finish up with a final height measurement, and it turns out to be 164 centimeters. A bit of a difference, which we'll monitor. She mentions feeling much better, lighter, and with reduced pain. I ask her if she notices the difference, and she happily confirms. With that, we conclude today's session. I thank her for her patience and bravery. I also thank all the viewers for staying with us through the whole process. Don't forget to subscribe, leave a comment, and join us again for the next session. Thank you for watching, and see you next time.